have any questions before we move on?
Have you ever gotten, I'm just thinking of my patients and some are very particular about what goes on the perineum, the vulvar tissue. So do you ever get that question of like, oh, I don't feel comfortable putting that on my skin or
With
like,
the shower cap?
well, because you said there needs to be something on the patient's skin. Are we using that same,
The gel?
that particular gel? Like,
So I've personally never gotten that before,
Okay.
but we do have, which, no problem.
I mean, it doesn't happen often, but I literally have like the best lubricant, and I still have people bring their coconut oil in with them, and like this is all I can use because I'm
As
so
long as
sensitive.
it's water-based,
Okay.
it will work.
Okay.
And so if they,
So not like a coconut oil, it would have to be like a water-based
it has to be a water-based lubricant.
Okay.
So
So
my
we-
cellar water works,
Okay. We have
lubricant,
slippery stuff
Yeah.
with Clean Love. Are those,
Mhm.
okay,
Oh, yeah,
cool.
that's
Yeah.
water-based, yeah.
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 Okay.
Okay,
and then we also use sterile gel as well if they prefer this.
okay, great.
The sterile gel isn't super, we mostly use this for like infected wounds.
Yeah.
So it's
Yeah.
not
You don't need to
100% necessary
Yeah.
for
Right.
the pelvic and things like that,
And
but
that's
there
the
is, it
exception,
is
but
an
there are,
option.
I've had those patients where
Yeah.
they're just like, oh no.
Yeah.
No, understandable. I mean, you gotta watch what
Yeah.
is being,
They're so fearful. I mean, yeah, they just.
yeah, absolutely.
Okay, all right.
All right, let's talk about contraindications. So things that we do not treat. First one is going to be pacemaker. You guys won't really have to worry about this unless you're planning on treating shoulders
Yep.
up and stuff. The true contraindication is that we do not treat the chest, back, neck, anywhere near the pacemaker. We can mess with the rhythm of a pacemaker, so we stay away from it. I personally lean on the safer side of things. I don't treat patients with a pacemaker.
Okay.
Just because even though you've set a therapeutic zone for the shockwave with your energy level, shockwaves do travel through the entirety of the body until they hit air. So just a liability thing. Next one is going to be active cancer. I mentioned this earlier to you guys that they're doing some really cool research in Europe with our device. But as of right now, it's a contraindication for us. We don't target active cancer. The thought is we help with poor blood supply, so we don't want to feed any blood to the tumor. But if it is not in the region that you are treating, I would feel comfortable treating where you need to. The third one is going to be fetal tissue. This is another one where I personally don't treat pregnant women, and especially in the region that you guys are looking at, I would definitely stay away from the fetal tissue.
Right.
So we don't treat the abdomen or the back of a pregnant woman, but I just don't treat pregnant women. I mean, I feel bad for them, but also come back after. We can help you then. This works really well for C-section scars, all the pelvic floor stuff that they're
Postpartum,
dealing with. So,
So C-section you can do here, but you're saying for all pelvic floor conditions, it's just on the perineum. We would never do anything like up here, like
through the perineum.
Yeah.
Yep.
There were some really cool pictures of like C-section scars going away.
Yeah.
Yeah.
I have been treating my best friend because she really wants to try for a VBAC, and it helps with scar tissue. So
Interesting.
we're working on it. Yeah.
Oh, interesting. Yeah.
But her scar is almost
Gone.
Yeah, that's crazy.
Hmm.
It's just the internal that we gotta nail. Okay, so those are the three big contraindications. Now there are some cautions as well to the device. So your first caution is going to be cortisone injection. We don't treat over the injection site for 21 days. You guys probably won't have to worry too much about this unless it's in their back. I would still kind of wait 21 days to treat them. Our therapy kind of argues with the cortisone, so it can potentially cause them more pain after treatment. Another caution, we mentioned the tinnitus, the ringing in the ears. If you're ever treating shoulders or up, you may want to offer the patient some earphones, some headphones or some earplugs, just to make them feel a little bit more comfortable. But it is going to irritate the ears a little bit. It just happens. It always goes away, whether it's right after treatment or a couple hours after treatment. But we've never had a case where it's stuck. So. And they're also treating for tinnitus as well. It's like such a weird, I know. And you're like, don't do this, but we also help it.
Well, that's why the shockwaves are being used on cancer, like on solid tumors though, so.
That's why it doesn't make me too nervous.
Yeah.
We live in the United States, so.
Yeah.
CYA.
Yes. Another caution is if they are on blood thinners. This is more for pain treatments, but blood thinners could potentially cause some bruising in the treatment area, so it's good to warn the patient beforehand. And if there's any known blood clots, we do want to stay away from those. We don't know if we can dislodge them. And then this is probably not something you guys deal with too often, but potentially we ask if someone is under 18, they have parental consent. We don't know if this can potentially harm growth plates in the future. So when it comes to treating kids, I would say under 14.
Yeah.
We're just going really low on the energy, very slow on the frequency, just to make sure we're okay. Okay. Any questions on the contraindications? There's not many. And there's a video online about those too, if you ever need it. I also brought some consent forms for you guys to have. So they're listed on there as well. So I'll leave this folder with you. Absolutely. And then there's some post-treatment in here too. So one of the biggest things I think that is beneficial for the technician is setting the expectations for your patients, right? Unfortunately, our post-treatment is kind of directed towards pain because that's our biggest vertical. Sure. And so there is some potential for you guys to look this over and maybe tweak it. Yes. And that's totally fine to do.
Yeah.
So a lot of times when you're treating for pain, you expect their pain to decrease for about 24 to 48 hours. This includes the pelvic floor pain. But 24 to 48 hours is that normal time range of when they're going to be feeling really good.
Yeah.
After that, a lot of times their pain does resurface or come back. That's completely normal, and it doesn't mean the treatment didn't work. That's the biggest thing I want to make sure my patients know, and so they're not feeling defeated when that pain comes back. We've modulated inflammation, and we've brought in that new blood supply, which is helping decrease the pain, and I explain that as if it is somewhat of a bonus to the treatment. Decreasing their pain is awesome right away, but it's not the true healing. So it does take 8 to 12 weeks for your stem cells to kind of go through their healing process. And so with the pelvic floor treatments, you're doing normally a total of 6 once a week, anywhere in between that 1,000 to 2,500, just depending on how the patient's feeling. But you should really start to see a difference by that 3rd or 4th treatment. They should be feeling better for longer.
Right. And then you want to continue after that just to finish the treatment, or are you gonna go based on symptoms? Finish the 6 weeks.
Keep going. Do the 6 weeks.
Because I saw there were some protocols that were like end at 3 or 4 weeks, but that's just.
If you want to up the number of shock waves, then you can do 3 to 4 treatments.
Got it. Okay.
Yeah.
That makes sense.
So that's normal as well.
Yeah, that makes sense.
All right. Another thing we ask of patients is that they're not icing the area after treatment. It kind of just constricts the pathways for the stem cells to travel. And then we also ask that they don't take any anti-inflammatories for 2 to 3 days, if possible. Now I know some people are like, wait, I have to take my medication. It's okay. It's not going to completely negate the treatment.
Warm baths are okay?
Warm baths are fine.
Warm baths should be good.
Yeah.
And then
I don't recommend like a cold plunge that day.
We usually do warm baths. And then other topical medications that we use a ton of topical compounds that are like, smooth channel. What am I talking about? Wow. Smooth muscle relaxers.
Those are fine.
Vasodilators, so it should
those
help with it. Yeah. It's too early. I haven't finished my coffee.
It's okay, I totally get it.
Heating pad, that would be okay?
Heating pad's fine, yep.
Okay.
Do you hear anyone using it just for like pelvic floor muscle tightness? So, your pelvic pain, but it's like they have tight muscles to try to help get some blood flow to the ischemia there.
Yeah, absolutely.
Okay, cool.
Absolutely.
Because I think the primary thing we're treating is like internal sphincter spasm, right? Levator ani, and then, some of that like overall like muscle, like pelvic floor tightness that, is like, they're having constipation and, some bladder symptoms as well.
Well, and I love this because I have so many patients that will work vaginally, get them good, and then I'm like, oh, we're not 100% there. And it just, now I've been doing this long enough, I educate them on the front end. I say, we really probably may want to assess things rectally just because of the external anal sphincter with the superficial general muscles.
Right.
And so say, you know, we may want to do this. Well, some people are just like, yeah, no, we're not going back there. You know, so then we can say, okay, we're going to get things as good vaginally. I can send them to you,
And then you
know how to
send
go
them to me
inside. They can just
because-
externally do this
Yeah.
and help get those muscles to release. Because like we can get things good vaginally, and then I go rectally, and it's like, oh my god, I can't even get my fingernail inside. It is like.
Well, I always tell people like the
mysterious.
pelvic floor is like this, right? You know, you have bladder and you have vagina in the middle and you have rectum, and when
Yeah.
everything's tight, it's too tight. When everything's loose, it's too loose.
Yeah.
And then you get
It all
incontinence.
affects
So
that.
basically, somewhere in the perineum, right, we're gonna probably like attack those points,
Yeah.
and then you're gonna try to relax everything and improve blood flow. So I
Well,
think
I see
that makes
sometimes
sense.
like posterior pelvic floor can be so tight it pushes things anteriorly. So they're
Uh-huh.
having like vaginal prolapse.
Yep.
They're having
a
symptoms show
rectus
up.
ceiling.
Yeah,
Yep.
and like right, and it's like we got to release this tension in the back. You know, they actually don't
Yeah.
have bad tension in the front, but you know.
You should warn them that most of the time I will examine them.
Yeah. Okay. Good. Well.
Yeah.
Yeah.
Which is
okay.
what Stacey
Yeah.
Roberts recommends.
Yeah.
Anyway, as part
Like,
of the
I mean,
protocol.
Almost 100% I have to, but
Yeah.
like, you know, if they absolutely are like no, then no, but most of the time I would really like say it really is beneficial for me to
Yeah.
examine you, so.
Yeah.
Absolutely.
I
Yeah.
agree.
Stacey
I agree.
adds that into her protocol, and I know that's not on the videos because
Yeah.
that's kind of like her
Right.
niche.
But
so
like that's
she
like
will give that
that's
to
what
you
I
as
do,
well, though.
you know, this
Yeah.
finger and that.
Yeah. And that whole.
This finger and that hole.
Yeah, I'm sorry. Yeah, and I just say like most of mine will, and you know, just I'll kind
Eventually,
of give them,
yeah,
I'll give them
yeah,
the heads up. I'm
yeah.
like, just down the road, and they're like, okay,
Yeah.
let me process a little bit. You know.
Yeah.
And some people are like, whatever you need to do. Yeah.
Right.
Yeah.
Okay. So I think we have half an hour till our first patient. Do you want to
Okay.
like break it down and then?
Yeah, let's go
Should
over
we do that?
shutdown.
Yeah.
I'll show you guys kind of how to turn it off every
Yeah.
day, and then I'm also going to show you guys what to do when you run out of SoftWave. So
Okay.
you're trialing it for 3 months,
I think
correct?
it's 3.
So those 2 applicators should last you the
The
3
entire
months,
3
but
months, yeah.
I mean, we'll see how busy you get. So
Right.
you may have to turn one in for a refurbishment during
Sure.
the trial period, and that is an easy process. So
Yeah.
this is me showing you how to shut it off every day. You do not have to unplug the applicator and the water cartridge every single day. You can leave those plugged in unless it is time to swap those out for a refurbishment, or if you are traveling with the device. So if you're putting it back into the carrier
Right.
case, it cannot be put in there with these plugged into it. It'll cause some damage. So at the end of each day, when you're done treating patients, all you need to do is hold this yellow power button down for about 3 to 5 seconds. It's going to start to shut your screen down, and then it's going to start to drain the applicator. So you can hear the pump. It's kind of pulling everything through. Yep, you'll see that kind of shrink. And you're going to be standing here for about 45 seconds again. So it's a bit
Good
of an
arm
arm
work,
workout. Yeah. We call it the Statue of Liberty. I do see some people get like an IV pole or something tall and just kind of
Oh,
hang it on there, which is totally fine
Yeah.
to do. A hook on the wall or something.
It's not that long.
Yeah.
45.
Yeah.
No. Well, you say that, but then you're also like,
Yeah.
Yeah.
Or unless you have like a brachial plexus injury or something.
Yeah, yeah.
So once your lights on your dial stop flashing and you have one stagnant light, that means the drain is complete and you're good to shut it off. So you can just flip that toggle to off, and then set it down, and you're good to go at the end of the day.
Okay.
So
Now-
you would obviously replace that for each, like you're replacing that, so that would all be off.
The shower.
The
Yes,
shower head,
yeah,
Okay.
Now, I'm gonna turn this back on. For the sake of time, I'm not gonna fill it and re-drain it.
Yeah.
But normally, when you need to eject the applicator and the cartridge for that refurbishment, or if you're swapping them out, you'll need to drain the applicator again. So there's a button here labeled drain. Same thing we did when we were turning it off. You'll hold it up. That button will turn white as it's draining and back to gray when it is done draining. So once it's done, then you're gonna go over to your setup screen. So you have a button here labeled setup. You'll click on that. These are different settings for the device as far as like brightness, language, date, time, etc. But the 2 most important things on this screen are your applicator button and your cartridge button. So when you press applicator, gonna push it out for you on the side here. It pulls up this blue box just letting you know it's released the applicator, so you can hit OK there, and then you'll hit your cartridge button, pushes it out of the bag for you.
Nice.
Okay, so then you'll box these back up into that original white box. There's a photo on the top portion of that box just showing you how to wrap it back up and everything. And then if you do need to send it in for refurbishment, which I would go ahead and just do that even while you're on your trial period, just in case, so you always have a backup.
Oh, okay.
You'll send it into our warehouse, which is actually over in Kennesaw.
Oh.
And so it may
you
be
guys are
quicker for
Yeah.
someone to
Yeah.
even just drop it off, and then
Yeah.
you can pick it up in the next day or two.
Oh, wow.
The normal refurbishment process when you're shipping it in, I say it takes about 7 to 10 business days, but that includes the shipping time. So the true process only takes 2 to 3 days.
Cool.
Okay. Let's go back here to our main screen. I'll just plug these in really quick.
What is the solution in the cartridge?
Potassium bromide
Oh, okay.
for salt water.
Yeah.
But that just helps the conductivity for
Right.
the SoftWave,
Right,
and
'cause it's
so
salt.
if you guys ever again spring a leak for any reason,
Yeah. And what are the most common error codes that people call you?
I wish during the training I could make one pop up, but
Yeah.
unfortunately I can't.
Yeah.
I would say, and this is not a knock to our providers, but one of the biggest ones we get is the 224, which means the applicator's not plugged in correctly.
Okay.
So making sure you
Yeah.
hear that click is huge.
Yeah. No, that's good.
Yes, and
Yeah.
then if you're not hearing the click, you're probably gonna get some leaking that's happening when you're
Of the
trying to fill the
solution. Yeah,
applicator, yeah.
Okay.
So just making sure you plug in that applicator is a big one.
It's like my Nespresso. If you don't plug it in, it leaks in the back.
Right,
Yeah.
exactly, and that's important, you know? That would be probably the biggest one I see.
Okay.
The other thing I see is potentially, popping a small hole in the membrane here.
Okay.
So it doesn't happen often, and this membrane is extremely sturdy. I don't think it'll happen very often for you guys either, since you'll be covering it for majority of your treatments.
Yeah.
But when you're treating for pain especially, if there's too much friction in between the skin and the membrane, that can cause a tiny rupture in it, where you'll get a little bit of leaking, and you'll see it. It'll be a long stream of water. And you have an extra membrane in that box, and basically there's a video on our support website. All you need to do is pinch the side of the membrane here, rip it out, and then you'll be able to untwist this yellow ring here. Then you'll take your new one, place it on, twist the yellow ring back on. So that's a very easy process. And as soon as you see that it's been punctured, you want to close that puncture and then drain it immediately. So you'll hold it up, drain it, swap those out, and then you should probably, unless it's been leaking for a while, that cartridge should still be okay. But the device will tell you if there's not enough water in the cartridge. It'll say your water level's too low.
Right. Got it. Okay.
So those are the two biggest things I see. Everything else is not very common.
Okay.
So
Awesome.
shouldn't have to.
And
worry
that
about
doesn't
too
have
much
to
of that.
come out except for when you're replacing it, so it's not like you get that 224.
A lot, right? Yeah, most of the time it happens when they have gotten a refurbishment back and then they're plugging in there.
Okay.
Yeah.
Got it.
Yeah.
Interesting. All right.
All right.
Do I try it on your neck?
Sure.
Yeah. I'm gonna take the cover off
Yeah.
for now.
Should I get my headphones?
Are you sensitive?
You'll be okay.
You can do my knee next, but I have pants on, so that's why I thought your neck would be easier.
Yeah. Let me just take off. I have a shirt.